meet you at the station. You can be here by 4:30 because I've made your reservation.
Hello, everyone. Thanks for joining us. We're just going to give a few minutes to let people come in and join. So enjoy the music while we wait.
We'll have one more night together till the morning brings my train and I must go. No, no, no. No, no, no. And I don't know if I'm ever coming home. Take the last train to Foxville. I'll be waiting at the station. We'll have time for coffee, belated kisses, and a bit of
Hey, I think we are ready to start. We have some folks joining us. Welcome, everyone. Thank you so much for joining us today. Metro Conversations, partnering to address food insecurity. We're really excited that you're here today joining our second installment of Metro Conversations. And Metro Conversations, if you haven't joined us before, is a virtual series where we're bringing you stories about Metro's work that is enhancing the quality of life for communities in LA County. So I'm Christina Harrington, part of Metro's local government and community partnerships team. And during this 1 hour with us today, you'll hear a panel discussion and we'll open it up for Q&A at the very end. So feel free to put in your questions in the Q&A in the meantime, and we'll get to them at the end, depending on how much time we have. So, and it is meant to be a dialogue today. We do want to hear your ideas and your thoughts, and we want to have a conversation with you. So please do share those questions with us. Next slide, I will review some housekeeping. So as I was saying, we are going to take questions after the panel. If you're joining by computer, you can enter your questions in the Q&A you should see on your control panel, or you can raise your hand to join a speaker's queue. We do ask that you keep your questions brief if you are asking them verbally so we can get to everyone. If you are joining by phone with us right now, you can also raise your hand by pressing *9 to join the speaker's queue. And when your phone number is called, you press *6 to unmute yourself. And then if you are listening to any questions that may be asked in Spanish, if you want to understand what they're saying, you can click the interpretation icon on your Zoom and hit the English channel, and then you'll be able to understand what the Spanish speaker is saying in English. Our interpreter, Diana, is helping us today. And same for anyone listening in who wants Spanish interpretation, you can select the Spanish channel. The next slide, I will be reviewing some community guidelines. Again, today is meant to be a dialogue, a discussion with you all. And so we do ask for your help to create a safe and comfortable space for this conversation. Please treat fellow community members here today and our panelists respect. Try to use a conversational tone at all times and address all your questions to our panelists and not to other attendees. We just want to make sure that everyone has a chance to ask their question in a safe manner and respond accordingly. And if you are submitting anything that is inappropriate or not respectful, we'll give you a warning, and if need be, we will ask you to leave the meeting. But I'm sure today will be a great conversation. So thank you all for that. And then the next slide, I just want to really briefly, before we have our panelists introduced to you, go over a little bit about Metro, because we are really unique as far as transportation agencies goes. We are the funder, the planner, the builder, and operator of the vast network of Metro bus and rail in LA County. And so naturally, when we say Metro, people think about how we operate buses, how we build new rail lines, or how we operate Metro bike share. And as essential as all that work is to support our communities, we also do so much more than that, that enhances the quality of life for our region as well. And it's that kind of work that's not super well known, but still is making a big impact, is why we invite you here in Metro Conversations to learn a little bit more and discuss with us during this virtual series. And so in our next slides, I will also just note that a theme you're going to be seeing and hearing today is how we're partnering with organizations to meet the needs of communities in LA County. And before you hear from our panelists today, we'd like to share a new video that has been put out on our blog about the Mobility on Demand food delivery program. And with that, just give us a moment to share that video with you. We can. Technical difficulties in this new world. All right, here we go.
My experience with the distribution has been beautiful, but at the same kind of heart-wrenching to know that our community is hurting the way that it is, but very happy that we're able to provide this service to them.
My experience is very nice. I like it. I like to help to the elderly and people who need food. So it's amazing. My experience with delivering and Metro is very nice. I like it.
So as you can see, that's how Metro Via does it. They come to our location, they get us to go, they ask for our table, which table that is gonna be for them. And so we're gonna see right now, she's leaving. Yeah. We're really happy to have this partnership with Metro.
All right, and with that, we'll share with you some of our panelists.
Our stakeholders.
Yes.
So
with that, I will pass it over to Julia Brown. Thank you.
Thank you, Christina. Hi, everyone. My name is Julia Brown. I am a community relations manager here at LA Metro. So first off, I want to thank you all for joining us today. Before we dive into today's conversation, I would like to introduce all of our panelists today. First off, I'd like to welcome Brenda Aguilera. She's the Director of Community Transformation for Para Los Niños. So welcome, Brenda. Next up, we have Cecelia Gibson, the Associate Director, Community Centers for the Antelope Valley Partners for Health. So welcome to you, Cecelia. Next up, we have Debbie Sheen. She is the Program Officer for First 5 LA. So welcome to you, Debbie. And then last but not least, we have Shaun Miller. He is a Senior Transportation Planner here at Metro. So welcome to all of you. Thank you for joining us today. And I'm going to point my first question to Shaun to get us started here. I'd like to set some context for the conversation today. So Shaun, if you could maybe start out by describing for us, what is mobility on demand? How did this Metro service get involved with food delivery? And how did Metro and our partner Via get involved in this? Shaun?
Great, thank you, Julia. And thank you so much for moderating today. And thanks to the rest of the team for putting this event together. But to get into it, the story of food delivery cannot be told without briefly telling the story of mobility on demand, or MOD as we like to call it. So MOD was a pilot operated by our partner VIA to provide on-demand first and last mile service to and from Metro bus and rail stations in 3 service areas, El Monte, North Hollywood, and Artesia. So what I mean by first last mile, for those of you out there that might not know, is so how do you get from your home to the station and from the station to your destination? Because typically Metro service is not door to door. So mobility on demand was an on-demand rideshare service, and it was meant to be iterative. The idea was that not only would we learn throughout this project, but we would make adjustments based on those learnings. So when the COVID health crisis arrived, this ability to iterate became just imperative. And the reason being, COVID changed travel behaviors. MOD did carry fewer passengers, but so we had some capacity to do something else. And at around this time in March of last year, First 5 LA reached out and they connected Metro with its Best Start community network of local nonprofit grantees. And we collaborated to support those nonprofits' food distribution efforts to their stakeholders. So the partnership started by delivering food and essential goods to approximately 30 families who were food insecure in the Metro LA Best Start community. That was in collaboration with Los Niños. Next slide, please. So just a little quick background on Best Start. First 5 LA, which is an independent public agency, invests in 14 geographic areas that have faced historic disenfranchisement and oppression. And these factors exacerbate family stressors like poverty and violence. This map illustrates those communities across 5 regions. Each region has a designated grantee which operates the initiative in the communities within those regions. And I should note that many of these communities are those that have been hit hardest by the pandemic. Next slide, please. So just very quickly how this all works. Our local partners like Los Niños and Antelope Valley Partners for Health, who you'll be meeting here in a few minutes, identify the need for deliveries in their communities. And so these might be seniors, it might be families with young children where access to the store is difficult, families that might have issues around transportation access to groceries. They send the need for deliveries to VIA. VIA is our operations partner here. VIA sends their driver partners to the food distribution hub to pick up the packages. And then those packages might be groceries, they might be fresh produce, they might be hot prepared meals. And then those packages are delivered to the recipients. So in this model, Metro, through its Mobility on Demand project, is providing the transportation only. And we are now re-procuring food delivery for another 12 months as a standalone project as well. But I could go on to with the details of all of this, but I think we're here today to hear from Debbie and Brenda and Cecelia, and they're the ones that are really on the ground making all of these distribution efforts happen and standing these up in their communities. So with that, I will hand it back over to Julia to introduce the rest of them.
Thank you, Shaun. Thanks for setting the table for this awesome conversation. And so now I am going to move over to Debbie. Welcome again, Debbie. Can you tell us a bit more about what First 5 LA is and the Best Start program, and how did this partnership with the community-based organizations come about?
Sure. Hi, everyone. It's really great to be here with just a panel of really passionate individuals who are really committed to serving our communities. And I'm going to share a little bit about a background on First 5 LA that helps shed some light on why we feel that this particular project and the partnerships behind it are so important. So First 5 LA is a publicly funded agency that serves all of LA County. Our North Star is that every child in LA County will enter kindergarten ready to succeed in school and life. And so we focus on initiatives for children all the way from when they're in their mom's bellies, so prenatal stage, to when they're 5 years old. The reason why we focus on this age group is that the data shows that a child's brain is about 90% fully developed by the time she reaches 5. So the first 5 years of life are very critical to a child's well-being. And when we also took a look at the data on what helps healthy brain development, we saw that the community conditions in the neighborhood where a child grows up has a big impact. And in essence, the place where a child grows up matters. Whether the child's neighborhood has parks and green space or options for healthy food and groceries, or access to transportation to get to doctor's appointments and family gatherings, all of these things that make up a physical neighborhood, it takes resources, often public resources. And we know that many neighborhoods don't get the same resources as others in LA. And so the question is, how do we ensure that the resources that improve community conditions flow into all neighborhoods? so that we can give all of our children the same opportunities in their early years. And what First 5 LA learned over the years is that the parents, the caregivers, the residents, all of the people in a child's village, they're in the best place to identify what and how to improve these community conditions. And something else that First 5 LA learned is that organizations who are the trusted partners in local communities, they know the families of their communities and walk alongside them during difficult moments like the one we're in with the COVID pandemic. And so First 5 LA developed the Best Start Initiative a decade ago in the 5 regions of LA County that Shaun showed us earlier in the map. And the purpose is to create a platform where parents, caregivers, residents, they come together with CBOs, organizations, and county partners like LA Metro. And the Best Start Initiative brings all of these partners together so that the community can become an essential part of that decision-making process that directly impacts the kinds of resources that flow or don't flow into their communities. And as a county funder, that's why we are really adamant to continue to partner with those trusted in the field, our CBO partners, to work with us to strengthen the local communities where our children are growing up. And so that's a little bit about First 5 LA.
Thank you, Debbie. That's great work that you and your team are doing. I would like to move over now to Brenda and then to Cecelia. If you can tell us a bit about your respective organizations, what you do, and how you guys got involved with the Best Start program.
Thank you, Julia. Hello, everyone. My name is Brenda Aguilera, and I'm the Director of Community Transformation at Los Niños. This year, we'll be celebrating our 31st anniversary, and our roots began by serving children and their families with childcare support in Skid Row, Los Angeles. Our model fosters pathways to success through excellence in education, powerful families, and strong communities for children and youth to thrive. We do this by providing the community with early care and education, charter schools, family services, mental health support, youth workforce services. And then as Debbie shared in 2009, First 5 did this whole pivot where they understood that the services were really helpful to provide families and communities with. But I think they also understood that if they didn't address the systemic barriers that existed, no matter how many resources and family supports they provide, the conditions don't change in the community. So this is a big pivotal moment for us as an organization, because we were also a traditional service-oriented organization. And in 2009, when we were awarded the First 5 Best Start Pilot Award, it was to help them develop a partnership that was really led by community residents and partner organizations like CBOs. We had elected officials, faith-based organizations, businesses, county and city departments that make up this partnership in Best Start Metro LA. So we learned a lot during those 10 years about what real partnership looks like on the ground with residents. By maybe like the second or third year, I say that we had a very successful model, a very successful place-based model with a partnership with the residents. So they've been working together since 2010 is when the partnership established. And what they've been doing is identifying those core issues in the communities, and they develop strategic plans to address those issues in collaboration with everyone. So they develop them, they implement, they run the evaluation, they make improvements, and then they go into action. So it's like a constant cycle that they've been going through for the past few years. In 2018, we had the opportunity to scale our approach. First 5 awarded us the regional contract. So we're now supporting local contractors in East LA, and we're serving as the local contractor in East LA, and we're partnering with Child 360, who's now supporting as the local contractor in Southeast LA and South Omani. So it's been a bit of a shift for us. Obviously, with the pandemic, a lot of our families, as Debbie said, like there's so many needs that have come up, but I think the technology gap is a big one. So not being able to partner and meet with them in space like we used to has definitely impacted our work. But we've definitely been able to pivot to work in this partnership.
Well, thank you. I'm glad to hear that you guys have found a way to still be able to continue this important work. And so Cecelia, I'm going to pose the same question to you. If you could tell us a bit about your organization and how you all became involved with the Best Start program.
Thank you, Julia. Thank you, everyone, for being here today. I'm super excited to share what Antelope Valley Partners for Health does for the Best Start community. So Antelope Valley Partners for Health is a nonprofit, and we are located in Lancaster. We're part of the Best Start Community Region 5. We serve the Best Start communities of Lancaster and Palmdale. We partner to improve the outcomes for our community. Antelope Valley Partners for Health, again, we offer programs, about 15 different programs, from prenatal to senior citizens. We have a welcome baby program and healthy families that we are funded by First Five. And so that's how we came into being part of Metro's Mobility on Demand when COVID hit back in March of 2020. We were lucky enough to be given this opportunity to help our community up in Lancaster and Palmdale. Thank you, Julia.
No, thank you, Cecelia. And so now I'm going to jump back to Brenda and ask if you can give us a high-level understanding of the situation on the ground during this pandemic, about the communities that you serve, and why is this program so important to those communities during this difficult time?
Thank you, Julia. And so when the pandemic hit, we worked with a number of promotoras, community promotoras, that work directly with the residents. And it's really thanks to them that they have a really strong pulse in the community. They were able to quickly find out the challenges that the families began to experience. It was primarily had to do with economic challenges. So a lot of the providers in the family were losing their jobs. And then immediately after, maybe within 2 weeks, families started to test positive. And these are like hot zones in Los Angeles. There's families that live in really condensed neighborhoods. So they share, you could have a family of like an average of 4 or 5 family members that live in a studio apartment. So being able to isolate it's impossible. So the families were testing positive early on. And then there was a need. One of the things that we started to hear right away was that there was a need to access food. So they were, we had reached out to a few partners that have, some of them actually run food pantries. We reached out to some of the other organizations that provide the support, but there was a clear transportation, or I would say like a gap in just being able to connect the residents to the food banks and to the pantries, because a lot of them do rely on public transportation to drop off their kids at school, to go to the doctor's appointment, to go grocery shopping. So using public transportation became a high risk. And also they weren't aware of where to find a lot of the food banks. And when we were contacting the food pantries and the food banks, I think they were also experiencing the same challenges, because there was a rise in need. And yet they were also trying to be cautious about putting their staff at risk. And also they realized that it was just it was a long stretch for families to be able to access. So those are the first things that started to surface, at least with food. And then immediately, with the rent moratorium helped. But I think there was also the concern that with the rent moratorium, what happens after if families can't even bring the resources together to pay 1 month? So we're hearing about evictions currently, even with the moratorium. There's families that unfortunately now, a year later, there's deaths in the family. So we've had a lot of our partner residents who have lost family members. So they're going through an extreme crisis at the moment. But we were able to share this information with Debbie, our program officer, early on. And I want to say that one of the things that we're really thankful to First Five is, and the team with the communities department, is that they've been able to really be able to uplift like these challenges in the community. The resources weren't meant to be able to provide like the direct support, but I think you know, I think it speaks to the way that a system and an institution can really look internally about their, and look at their policies to see how they're also creating those barriers. And thankfully, they were able to have those conversations internally. Debbie, I'm assuming you guys took it to your leadership and to your commission, and thankfully they changed the parameters so that we were able to support the families with those support. I want to say one of the successes of this support is that we were really lucky to also count on organizations that we've had a number of years of partnership with these organizations for the past, I don't know, 30, 40 years, and some very new partnerships that we were able to establish. So we were immediately able to create like a network of hubs that are serving as local distribution hubs. Because we wanted to ensure that if we could bring those resources locally, families could at least walk and not have to take public transportation. But then we know that there's families in home that have the little ones. So even walking and while their kids are in school with remote learning was a challenge. So we were eager to try to find a way to bring those resources to their homes. And that's how the conversation started with Debbie early on.
Wow, thank you. I mean, that just goes to show how important these partnerships are. And I would like to pose the same question to Cecelia. If you can give us a snapshot of what the situation is on the ground in your communities. If you have any success stories that you would like to share, that would be great as well.
Sure, thanks, Julia. So as I mentioned back in March of 2020, when COVID first hit, the senior citizens in our community, well, all over, were afraid to go out. You know, they were being instructed to stay home, stay safe. We also had families in crisis that are homeless and live in motels. And, you know, school was shut down. So the children were home with their parents. They weren't being provided breakfast and lunch at school anymore. So we, Antelope Valley Partners for Health, we partnered with the city of Lancaster to provide food for our seniors and the families in crisis. So we deliver daily, Monday through Friday, we deliver a hot meal to all of them, to all of our seniors, all of our families in crisis and that live in the local motels here in Lancaster. And then we serve, everybody gets a grocery bag. They also receive essential bags, and everyone receives frozen meals for the weekend. So that would be our senior citizens in the community and all of our families in crisis. And, you know, we're so lucky to have had the city of Lancaster step in to help, you know, provide this service. And then at the beginning, we had staff and volunteers come in, and we were delivering 520 meals a day, and the groceries on Thursdays, and then our frozens, and then MOA, which is a local art museum here in Lancaster, they started getting involved, and they were creating craft bags for all of the children that lived in the motels. So then our drivers were delivering these little craft bags, you know, to help the kids, you know, be entertained, something to do, no school, you know, it's this whole new environment for everybody. So we had volunteers, we had staff doing these deliveries. Then we were lucky to start to work with Metro, and Metro came in and saved the day. We had drivers coming in, you know, all of our seniors and the motels we call them tracks. So they're all broken down by the areas that they live in. So each driver has a track of meals that they deliver. So when Metro came in, Metro picked up, first we had one driver, and she picked up 2 tracks. So we were able to get 2 staff members off of those daily deliveries. Then Metro was able to provide us with another driver. And thankfully, we have right now, we have 3 drivers. Well, not right now today, but we do have 3 drivers that are so committed, and we still have about 6 staff members, including myself right now temporarily, going out and making deliveries. And the senior citizens and the families are so grateful. They're so appreciative. Thinking of a success story, Julia, there are so many, I can't even begin to tell you, our drivers receive blessings from these people every day. We receive calls. Everyone's so grateful to receive a hot meal every day, especially our seniors who, they're still afraid to go out, So we are most grateful for the partnership that we have, and we look forward to another 12 months working with you all. So thank you.
Thank you, Cecelia. Thanks for sharing that wonderful story with us, and Brenda as well. I am now going to pivot back to Shaun. Can you discuss what some of the challenges or the biggest challenges that you've encountered so far with this food delivery partnership? And that can include whether it's the partnerships themselves, whether it's trying to do this great work during the pandemic. We'd love to get your thoughts on that.
Sure, thanks, Julia. And I think we've already heard a little bit about these challenges that Brenda and Cecelia are facing out in the field. The challenges on Metro side are a little bit different from the sort of project management perspective, but I would say that from my point of view, there are kind of 3 main challenges. The first one is just about the number of variables that are at play here, and those are logistical challenges, as Cecelia was noting, the types of packages that we're delivering: hot meals, frozen meals, art kits. And then, Brenda was noting some of these as well, some of the challenges with different package types. And that's one challenge. There are 5 regions. There are probably 12 to 15, there's a local grantee in each region. There are several sub-recipients as well, maybe 12 to 15 organizations across the board. Each organization has a few different package types, different delivery days, different delivery windows, different expectations for when those get delivered. But our partner VIA has been, I think, really incredible at trying to do its best to make sure that all of those needs are met as much as we can. But really, I think the biggest challenge, and this has some, I think, implications on Metro as a public transit provider and thinking about what public transit looks like in the future. It's just the duration of this crisis, and making sure that we can be supportive in the communities to provide continuing resources to them. I appreciate what Cecelia said about Metro coming in to save the day. I would characterize it a little bit differently in saying that Metro is providing a very small piece of the solution here, that Para Los Niños, that Antelope Valley Partners for Help, that Providence down in the Wilmington Long Beach area, that El Nido in the Pacoima and Panorama City areas. They're the ones that are coming to the aid of their constituents and their stakeholders in really carrying the weight of all of this. Organizations that maybe before did not provide direct services to the people that they serve, and maybe had no food distribution effort whatsoever at the beginning, and have somehow made some incredible things happen to make sure that the individuals in their communities are fed, and for this day they do not have to worry about where the food will come from, right? At least for this day, and hopefully for the next too. So that presents some really interesting and challenging questions for Metro, and thinking about, well, how can we provide the support that these organizations need, especially when so many of the delivery recipients do rely on public transportation. How can Metro provide that support, and to a much larger scale than we already are right now?
Thanks, Shaun. That's a great overview of Metro's perspective. I'm going to pose that same question to Debbie from her perspective. what have been some of those biggest challenges so far?
Yeah, I think, Shaun, you just shared some really great points, and we also heard from what the communities need. And I think I can really speak to just the countywide agency perspective as a First 5 LA staff member and build a little bit more on Shaun's last point. What we've seen in the COVID pandemic is that it's really exposed this need for all of us in countywide agencies to break out of our silos, work collaboratively across the many areas that impact community conditions. And this pandemic has shown us that the challenges associated with COVID are not a one county agency issue. And often our agencies are set up to be focused in that way. And when we look at the community members, they don't experience their lives in these silos. So as a cursory example, a family's economic security affects their ability to buy groceries, and then the options for transportation, above all, affects their access to jobs and those grocery stores. And this is an oversimplified example, but you can already see how all of these aspects are really intertwined in a resident's lived experience. And so the actions that the agencies develop, we really need to meet, in order to meet this pandemic moment, it requires us to look at these conditions in these communities through the lived experience of our community members. And it requires us to work together in ways that we've never done before. And we really have to ground our actions in the experience and the expertise of the people in the communities and the CBOs serving those communities. And the only way that we're really going to get there is by being in authentic partnership with the parents and residents and the CBOs of our communities. And before I end, I want to recognize that LA Metro was able to pivot and respond to the community needs to ensure that the public resources that they're entrusted with are being used to meet this moment. And this is exactly the kind of action that we're going to need more of to truly tackle the challenge of food insecurity. It's currently at alarmingly high numbers for the children of LA County, and we're going to need to have more of this type of action to really address the food insecurity challenge. And so I'll turn the mic back over to Julia.
Thank you, and great response there. I'm going to pivot back to my colleague, Shaun. If you can discuss briefly, what are some of the lessons learned from this partnership effort?
That's I think a really great question, and something we're still trying to tackle, right? Because as this program continues, I think we've had some success. We are supporting communities. We're providing meals to them. We expect to continue to do so. But at the same time, that success is something that is somewhat double-edged. Every meal that we have to deliver indicates a need in the community. And by all accounts, that need will continue to grow. But I think what we have learned at Metro is that we are able to do this. We are able to provide food delivery service, and we can do it cost effectively. This program has cost, in fact, less than it would take to, cost less to carry groceries or food to a recipient than it would be to carry them to and from the grocery store through mobility on demand. And also that's true, I think, on some of our Metro's lowest performing bus service that does cost a lot, and also costs individuals a lot of time. Some of those bus headways are, 30 to 60 minutes. So this can be a convenient service. We have learned that, individuals out in the community do have a need for this, and they do have an interest in receiving this. So we were able to run a survey in partnership with Los Niños in Region 1, and survey respondents indicated that yes, access to food has become even more of an issue. than it was before the pandemic. So you see the slide that was just shared. Food insecurity almost doubled by these respondents. And of those respondents, more than a third rely on public transit to get to groceries. Another third of them walk, and then another 10% of them are asking for rides. So you can see a huge slice of the pie chart on the right. Most of these individuals are not driving and need to figure out how to get to food. And a third of these respondents also noted that transportation is a barrier, right? So if we can sort of mitigate some of these trips for individuals, especially those that are at high risk, you know, it seems like there's a need. Additionally, I think there seemed to be general interest from respondents that they were interested in home delivered groceries, but technology, as Brenda noted earlier, is a barrier as well. And that's one of, I think, the important things about this partnership is that, you know, we're all relying on each other to provide that piece of the puzzle. So our partners are providing the demand to us, the need in the community, and we are coordinating with VIA to input that information into their software platform. VIA is then communicating with recipients via text message to let them know when their deliveries will come. And so, you know, these are individuals that may not have access to the more, you know, quote unquote traditional, you know, grocery delivery services. This is a way that does not rely on technology quite as much to get the resources out there to people.
Oh, great response there. I would also like to open that question up to, we'll start with Brenda and then we'll move to Cecelia. But if you would like to share some of the lessons learned on behalf of your organization.
Yeah, I think Shaun, you hit it right on the nail. A lot of, as I mentioned, like we rely on the promotoras, the community promotoras. So coordinating with families, it's all done by them. They do individual phone calls to about, I think in just Metro alone, there's over 300 residents that they're coordinating with on a weekly basis. And then our partners are probably doing about maybe anywhere from 50 to 100, all depends on how many resources we could also provide. So they definitely have more of a need. I think they have to rotate the amount of boxes, of food boxes that they give out. So there's just a lot of logistics that go behind it. Erika Lopez, who's our admin assistant for East LA, we've reassigned her to support regionally now to be able to do all the coordination between all of our partners. She's working really closely with Shaun and with VIA to be able to mitigate all of the logistics. And then when things kind of, you know, there's some gaps in between, like maybe a resident doesn't get the box or the driver can't locate the family member, Erika's like available. She's like on call during the distribution. So we really had to adjust like her scope to be able to support it. So there's definitely a need for resources to provide for the organizations because all of our partners have come in. None of them have a contract with us. They've really come in as through a true partnership to be able to do it. But I see them having to adjust people's, their scope to be able to support it. And they still have their program deliverables to still meet. So I do agree that there is an important place for CBOs to have and to have a stronger partnership with LA Metro and all institutions as a whole, but with LA Metro right now, I wouldn't want Para Los Niños to be the only one that holds this relationship. I'm eager to see how we could scale that to include more partners to be able to scale this service because as everyone has shared, like transportation has always been a challenge in the communities that we work with. We did an assessment with the Metro partnership, maybe about, Debbie, was like 3 years ago or four years ago. And it was when this happened because Metro Transportation eliminated tokens. And we learned about it through a Facebook message. And we really relied on tokens to be able to provide the transportation support for the families to attend meetings. So it just, it really did have a big impact, not just programmatically, but just the way that families are able to access the support to be able to navigate transportation, because they don't have, you know, they weren't used to using the cards, and they didn't have the machines in their local communities to be able to load the card. So it was a whole new system that they had to change without there being any conversation on the shift. And, you know, and maybe it would be helpful if they would have been able to be participating in the design, because I think that's the way that you could just make sure that all your services like ours are most effective. So with that change, we did an assessment with them, and it was more than tokens. What ended up surfacing is just like how much like they, you know, the lines that the bus lines that are in their communities, they're not as frequent, and then it's probably not the best type of transportation, because again, they're using transportation to just, you know, run their everyday chores with their families. So I would love to explore scaling this post-pandemic to see like if we want to reimagine transportation, like this is the time to do it. I think we've already been able to develop like the infrastructure for it with gaps, Shaun, like you shared, but I think there's an opportunity to be able to go through those pieces and be able to untangle it more with the partners at the table as well, and the residents.
No, I think that's great. I definitely think the opportunity is there. I'm going to let Cecelia have the opportunity to respond, and then we would want to open this conversation up to questions from the public. So Cecelia.
Okay, thanks, Julia. So lessons learned from this whole pandemic, you know, Antelope Valley Partners for Health has a food pantry the second and fourth Friday of every month. And, you know, seeing the community members come in for that, you know, we serve about 300 people. So with this pandemic hitting and us getting out into the community and meeting senior citizens, we're learning that our senior citizen community is so vulnerable. You know, what do they do for food insecurity? You know, some of the seniors that we do see, it's our drivers are the only visitor they have for a day, you know, for that day. They really build relationships with the drivers. They look forward to seeing them every day. And I think that our senior community needs, you know, more resources, more help to, you know, help them feel secure, you know, wherever they are in their life, you know. Our families in crisis, you know, they're living in motels. They've been there for months. You know, these poor children, you know, living in motels. You know, the lessons learned is we have to continue to work together, you know, find other resources for these people to help them, you know, and to help these children. Some of the seniors that we've come across and the families, you know, our drivers will ask them, oh, you know, how are you doing? Do you need anything? And the drivers will come back to the office. We have a resource wall. They'll look for flyers. They'll take the resources out the next day. We'll give our business cards out. We'll have the community members call in, and we'll direct them to all sorts of different resources that will help them. You know, I think that the lesson learned here is everyone needs help, you know, and I think that we need to all continue to work together when this pandemic is even over to continue to support our community members. Thanks.
No, thank you, Cecelia. And thank you all for the wonderful work that you guys are doing every day. And thank you for your partnership with us here at LA Metro. And so now I'm going to turn this conversation over to Christina. She is going to moderate the Q&A portion of today's discussion. So Christina, have at it.
Thank you, Julia, and thank you to everyone, all of our panelists today. It's just a sober reminder of all the need out there. And of course, it's really heartening to hear the fantastic work you're doing throughout the county. So thank you so much for your work and dedication. But yes, as I mentioned, this is a dialogue today. We really want to hear from you all. And I already see a lot of questions coming in, which is fantastic. So just a reminder, you can raise your hand if you want to say something verbally, ask something verbally. We just ask you to speak slowly so our interpreter can capture everything, and limit your question to no more than 1 minute. But again, feel free to type in your question into the Q&A. I see them coming in. If you're joining by phone, press *9 to raise your hand. And when you hear your number announced, press *6 to unmute. So let's get to it. I see a lot of questions all around the same similar thing, so I'm just going to group them together. When will they make this available countywide? And I think this is referring to the partnership with Metro providing the transportation.
So I'll take that one. Great question. Hopefully soon. Now, I think the unfortunate answer is that where we are at right now is we are continuing this within the Best Start communities for up to 12 months. We are in negotiations currently with the contractor. We expect to have that agreement executed within the next week or two and back providing service to these communities. We've been on hiatus for a couple of weeks while we do that. And then ultimately, you know, based on this, the outcomes of that, and I think continuing research, we are going to continue researching the effectiveness and viability of this service during that time. And, you know, and at that point in time, I think we will be able to present, you know, our leadership as well as, you know, others, the Metro Board, with, I think, some really great information, important information for them to see, where they can make decisions about expansion of a program if that's something that there's an appetite for within the agency.
Thank you, Shaun. Another question that's coming in from multiple people, and it's kind of related to what you just said, Shaun, but how do you plan to keep these services available post-pandemic? I don't know if you could speak to that, or anyone could speak to that more specifically.
Yeah, so again, we are continuing for up to 12 months. I think we would have an option to continue for another 12 months once that's complete. I would hope the pandemic would be over by that point in time, but obviously that is also, you know, what over is there's a different answer to that depending on, again, where you live. And I think that the reality is in many of our most vulnerable communities, the pandemic, you know, being over, you know, by all accounts, I think it will continue longer in those most vulnerable communities than it will in others because the resources are, you know, not as available in those communities. But I think that we will continue to provide this service as long as there's a need and as long as it's funded by the agency. I think it's really a crucial and important service. And like Brenda and like Cecelia and like Debbie, I would love to see some expansion of it to reach more, because again, the reality also, while we're focused on vulnerable communities, Best Start communities, need knows no geographic bounds. And, you know, 1 in 4 households are currently suffering from food insecurity right now. It was 1 in 5 before the pandemic. The pandemic being over is not going to solve this problem as much as we would like it to, or hope that it would. It will continue long after. And I think we should be thinking about how we continue to provide this support to communities, you know, as long as we can.
Thank you, Shaun. We have a question from Vanessa. Does the program have days that you have an overage of boxes? And if so, what is the contingency plan for the day's surplus? How do you mitigate a positive risk of food surplus? Whoever wants to jump in for that, feel free.
I think this would be a great question for Cecelia or Brenda to talk about their distribution. From just quickly the Metro side, you know, Brenda and Cecelia identify those households that have a need, and we deliver the packages, and any undelivered packages we're typically returning to the distribution site or some other prearranged place. But as far as the actual distribution efforts themselves, I think that's a better question for Cecelia or Brenda maybe.
I can answer that, Christina. So sometimes at the motels, hotels that we deliver to the families in crisis, some of them we're allowed to leave a package, their food, you know, if they're expecting it, that mom and dad, you know, left the kids in the room or something, we're allowed to leave it. Some of them we're not allowed to leave, and the drivers are given the approval if they see someone else on the street that is looking hungry or asking for food, you know, they're allowed to give them out. But for the most part, our seniors, they're home, they're waiting for their meal. So there really isn't an overage for those meals.
Yeah, the same for us, where we distribute out of a church location on 8th and Westmoreland, and we have people lining up at 2 a.m. now. Hoping to get on the waiting list for that, you know, for leftover boxes. We'll probably have like maybe 2 or 3 boxes. So we have to ask them to go home. We take their numbers and we call them to come back, you know, based on the order that we have them in. So it just speaks to the need. It really does. Again, we wish we had more resources to be able to distribute more. Because I think people are really relying on these boxes to be able to get through like a week of food.
Yeah, thank you so much for that. It's a lot of need out there. Well,
Christina, can I add one more thing?
Please.
Sorry to interrupt. So the other thing that I will just add to Cecelia and Brenda's point is that we were seeing with our partners at PLN that it's not necessarily the lack of food boxes that were the issue. It was getting those food boxes into the hands of people. And so this project has really caused us to question and figure out how we're going to resolve that these systems, the food systems, the mobility systems, and the community systems are not always in dialogue and partnership, and find ways to connect and build those relationships.
Great, thanks for adding that, Debbie. Well, it is just 1 minute past 1 o'clock, and I want to respect everybody's time. There are so many more questions that came in, and I'm sorry we couldn't get to all of them today, but you can always contact us with questions about the Mobility and Demand program, as well as the food delivery project, by contacting Julia Brown, our moderator today, and I'll drop her email in the chat, and you see it on your screen too. You can contact Julie with any questions about it, or if you have any questions about the Metro Conversations series in general, you can also contact us at metrospeaks@metro.net. So thank you all again so much. Thank you, Julia, Debbie, Brenda, Cecelia, and Shaun, everyone that helped with today. And thank you everyone for joining us. We look forward to seeing you at our next Metro Conversations in the spring. So stay tuned and have a safe and wonderful day.